Welcome to episode 2. I'm Jade Maloney, Operations Manager at the Institute of Health and Social Care Management. This episode features Dr. Claire Mould, founder and director of Curve Strategic, CEO of Heart of Menap England, and co-chair of the IHSCM Women in Leadership Special Interest Group. This interview was recorded live for the inaugural IHSCM Women in Leadership Conference on the 14th of March 2024. Claire has over 30 years of experience working with the public, private and charitable sectors, providing strategic, analytical and emotionally intelligent solutions that facilitate individual and organisational growth. Her work extends from postdoctoral studies on neurology, specifically the link between emotional intelligence and cognitive intelligence. She has contributed at a national, European and international level with writing, presenting and working to optimise growth potential in an accessible, compassionate yet strategic way. She joins us today to share her story, background and inspirations as a woman in leadership. What were her challenges? Who did she look at as inspiration? How did she get to where she is today? What drives Claire? And how does she maintain her well-being, given her multiple roles?
Claire is a fellow of the Institute, which recognises her contributions to such events as today, supporting activities, and she's also a co-chair of the Women in Leadership Special Interest Group. Now, Claire is director of Curve Strategic, a company that she founded, and she'll tell us more about shortly. And she's also recently become CEO of the Heart of Menap England, which is fantastic to hear. Now, Claire's experiences have shaped who she is today and how she leads. The opportunities she's had has driven her into her roles, and she's built strong relationships, but she's also had some setbacks. So let's hear how Claire's story resonates with us and inspires us to be better women in leadership. So Claire, tell us a little bit about your life. What were some key life moments that helped shape who you are today?
Well, so very rural background, very sort of, small, sort of right by the coast, grew up sort of quite idyllic in that regard. And I suppose even from then, I kind of realised that as lovely as this was, that it was just a small kind of glimpse of what was going on in the world, and that there was sort of like more to the world beyond that. So it was a lovely place to go and to grow up in. But there was more to that, and I was very aware that we were protected from the vulnerabilities, from people with disabilities so much, and multicultural side of things, because you just saw the group of people that you mixed with and you knew. So even from a child, we sort of moved up. And so I suppose from the onset there, I had a sense of, actually I want to sort of do more. I had a sense of how fortunate I was from the early doors, and then wanting to support other individuals, because you begin to see things that are going on in television around the world and you think, actually I'm really, really cosseted. And then I think that drove me, probably subconsciously at that point, to think, actually I'd like to do something that enables me to contribute in some way, and draw on the fact that I'm very lucky to help those people that aren't as fortunate as I am. So that was the first thing that I sort of thought when I was growing up in Cornwall. And so that was very idyllic, and then went on to university. And then because of careers, because as I quite like the idea of helping people, the careers teacher said that, actually being a teacher or being a nurse would be sort of the two main things that you could either go towards. And so I thought, teaching would be quite good of the two of those. And I'll tell you why. Primarily because my mum was a nurse, and I thought, well, she was a nurse, so I don't want to look as if I'm just copying her. I'll go and do something different instead. So I trained to be a teacher. And I'll be brutally honest, one of the things that really then frustrated me was I started training to teach in 1988. And that was the same year that the national curriculum was introduced, which was really quite key, because I thought, it'd be really, really great. I'm really fascinated with how people learn, how people develop. And just within this group here, I actually spent 4 years learning how to deliver the national curriculum. And I was a little bit grumpy about that. I didn't think this is what it'd be like. I didn't think it'd be just all about putting lessons plans together on teaching you how to do the national curriculum. But it was what it was, and I enjoyed my teaching practices and things. And then I fast forward, and then because as I'd wanted to move out of that Cornish background that I'd come from, I got my first teaching job right in the middle of Leicester, and really enjoyed that, but still found that challenge of thinking, I'm just delivering the national curriculum here, and I want to know more. And I had this sense of, how can we know that, if you took your car into the garage and you were, and somebody said without even opening the bonnet, oh, well, it's 4 years old, it does this, so this must be the issue. You'd say, well, hold on a minute, you haven't even looked under the bonnet. And I got that sense of, I don't even really know about neurology. I don't know about those things. So maybe I ought to go and do a master's in it. And then I will say, as luck would have it, but as the challenges that happen, I was actually involved in a really serious car incident, which quite literally took me out of teaching. And I was told that I wouldn't be able to go, because of my physicality and the way, because it had affected all of my spine, I wouldn't be able to return for at least 2 years. And I just thought, oh, gee whiz, what am I going to do? And then what I'd, was thinking, well, maybe this is a good opportunity to do my master's while I'm off, because my brain's still fine. And then I saw an advert for a research student. And I wasn't really altogether sure what a research student was at that stage. But I thought, well, that sounds really good. And it was looking at neurology and early learning. And I think, I'm not really quite sure still now what the impetus was, but for some reason I just thought, oh, well, this is something I feel really, really passionate about. So I applied for it. And it turns out, and I was very successful, and actually I got the research studentship, which meant that I could enable me to go on to do my PhD. And they were so intrigued as to why this person had applied without a master's. And I never did go back to teaching, but it set then the ground of realizing, in my specialism is between links between emotional intelligence and cognitive intelligence. And that enabled me then to be senior research fellow and begin to work more with communities. And I was doing that then. I was sort of studying my PhD, was linking with London and Coventry and Birmingham. So very much inner city stuff and working. And I realized then that what I wanted to do was working in health and social care, using that impetus that I had still when I was a child growing up in Cornwall, but now linking that with my neurological understanding to support individuals that are vulnerable and making some small contribution in any way that I can. And really, even though I've done many and varied things, so after being I went on to be senior research fellow in university, and I got a little bit exhausted, because the higher up you go in the university towards sort of professorial side, the more removed you get from it. And I was doing lots of publications and writing lots of papers and doing lots of keynotes, and very fortunate at the time there was funding available to travel internationally. And I worked in I worked in Kuala Lumpur University and Helsinki University and lots of different universities internationally. And actually was at Thessaloniki University when I completed my PhD. So I was very fortunate in that regard. But I lost sense of, I want to get back to the people again. So that's when I set up my first company that I set up, just supporting and working with individuals in the community to repackage qualifications to enable them to be accessible to everybody, because it's at a time that you couldn't go into, they were just introducing, you couldn't go into social work unless you had a degree. So I was chair of a community project in the middle of Birmingham at that time, and a lot of the women, predominantly women that I was working with, who were brilliant social workers, were really good, but they didn't have degree level qualifications, and they would have had to have retrained to enable them to keep their jobs. And I thought that's really unfair. And the reason that they weren't going to university wasn't because they were didn't have the right intelligence. It's because actually, from a gatekeeping perspective, they didn't quite fit in. So what I did was I worked with universities. So because as I'd been involved in getting lots of degrees right up to sort of doctoral level, I was presenting them, writing them, getting them validated. I just knew that as long as I had the core things, I just rewrote them in an accessible way. And delivered, you know, with individuals really going right back to the communities, supporting those individuals. And it was really nice. And I ran that company for 10 years. And one of the nice things was 3 of the individuals who were the individual women that I'd worked with in Birmingham, who went on to work with me in the company, because I wanted people that were delivering the programs to have come through the courses, asked whether they could take over the company, because at this time I had 2 children, was living in Cornwall, and ironically got to the point where I was before. I was being asked to write books and do keynotes talking about what I did with the company. And I thought this is a good time to hand over to be a CEO of a homeless charity. So supporting homeless 16 to 18-year-olds. Discharged from prison, released from prison, discharged from hospital, that also have complex mental health needs and learning disabilities and physical disabilities. So then I went on to be CEO of a charity right across the southwest that provide housing specifically for individuals that have complex needs, however they may present themselves. And then I ended up supporting lots of charities with regard to that. So I thought, actually, that was a good opportunity for me to step back from that, because I'd set that up to then run my own company, just going into lots of different charities and supporting them. And the reason that I'm now working, in addition to my company, working as CEO of Heart of England Main Cap, is because they asked me to support from an interim perspective to begin with, and then work with them. And then they asked me whether I'd carry on permanently. And there's lots of things I'm really enjoying getting my teeth into. And I've sort of taken that on as what I've done, because it actually fits in exactly with the golden thread of where my career, completely unplanned, but has ended up sort of following a particular trajectory.
It's clear that opportunities have been instrumental in where you are today, Claire, and the support that you've given to others. But what support have you had that was part of being your tribe, that helped you? You've got your children, you've got your family. Who else has helped you throughout your journey that you could see as your inspirations, that maybe put you on that particular trajectory? Or maybe it's somebody that you worked with that sort of gave you that push along to see the qualities in you, maybe that you should see yourself?
I would say predominantly, yes. I'm very lucky that I've got a supportive family and children, but have they been instrumental professionally? No, I think, to be honest with you, I'm not altogether sure that they're clear about exactly what I do, apart from the fact I'm not very often. I get dragged along to do things like homeless sleep outs and occasionally, and fundraisers and stuff. Apart from that, I'm not altogether sure they've ever read anything that I've written or heard anything that I've done, or know where I am. So I don't think they've been a professional inspiration. They've been a really good foundation in giving me a support. One of the most, there's a couple of, to use Charles Handy's phrase, golden nuggets of people that, and they have all been completely coincidentally, but they have been strong women that have gone in and done something in spite of potentially where their career path might have taken them. And one of them was somebody who ended up being my year tutor, sort of mentor person when I first went to university. She was a phenomenal woman called Eva Ross, and she and the reason that I loved talking to her, because her family had fled during the war. Some of her family had been, she was Jewish, and some of her family had been in concentration camps, and yet she bore no bitterness at all. She saw that as actually how much she'd learned, and she was just so inspirational that in spite of everything that she'd been through personally, she saw that she was blessed with an opportunity, that she had escaped from that, so really wanted to give back to other people. And it made me thinking, my sort of saccharine, oh well, I've had a lovely life being brought up in Cornwall, I want to give a little bit back, sort of kind of put that into perspective a bit. And she was really an absolute inspiration, and I used to like her at sort of our sort of symposium sessions at university and things, just because she just so naturally put everybody else ahead of herself, and she'd support somebody in such a natural, nurturing way. And I just think, gosh, how wonderful to put other people ahead. And she was very instrumental, because when I applied to do my research studentship, you had to put down a referee, an academic referee, and I wasn't really sure who to put down because I didn't have a master's or anything at that time. And so I asked her, and it turns out that she'd given me a really, really good glowing reference. And someone very similar was somebody who's called Jennifer Joseph rather, who I used to work with when I first started presenting, when I was doing my PhD, and we travelled internationally to present, and I'd never really presented before. She'd be just so supportive. And I remember one time we were going on to, it was the very first time actually I'd ever done it, and she turned around to me and I thought, oh well, at least Jennifer's here, she'll be really good. And then we were just about to walk onto this keynote and she turned around to me and she said, well, I'm going to let you lead this, Claire, because you know far more about this than I do. This was a woman, I should contextualize, who was in her 80s, was phenomenally academic, had done lots and lots of things, had really, really fought to go to university when she was younger. Oh, and we know, you know more about this than I do. And I went, I really don't, Jennifer. And she said, no, you do, but this is what your PhD's on. You go, I'll be there to support you. And I thought, well, I've got two choices here. So I went on, and she was just so nurturing and supportive. She used her expertise and experience in a way to really help me develop. She wasn't a role model as in, look how brilliant I am. Oh, I wish I could be like you. She used her skill to really subtly nurture me and give me the confidence. And so again, I really use that as an inspiration, because then when I'd been doing it a few years and I ended up having new people, I always tried to do exactly the same. And it's really good. And I think we see more individuals do that in profession. Rather than bringing the ladder up behind you, you actually throw the rope down and you support people up.
I think that's a key takeaway that you've just said there, Claire. We are, as this special interest group is, we are very much a supportive environment, and that is what we are here to do. We are here to create those opportunities, provide that support. And it's clear that anything that is thrown your way, that you set your mind to, that you can overcome. And I just wonder, have you got a current work or goal in life that you're aspiring to right now?
I've got themes that I want to do, and not in particular, because I end up just sort of, I go and I follow where opportunities are, though actually I always have that, like, nothing in my life is a complete coincidence, but you go where opportunities are. But my main goal, I think, that I'm really trying hard to do, and I'm meeting a few people next week about this, particularly working in health and social care with individuals with complex mental health needs and learning disabilities. I think from an inclusivity in the workplace perspective, I still think there's a way we can go to support individuals to just be members of the workplace. I work with a lot of people who are on the spectrum, and we've got to the point in the workplace, I think, the way that buildings are painted, the way that workstations are set up, the way that interviews are carried out, the way that jobs are advertised, where they're advertised, the way we position our stuff. I think that there's a whole raft of the community that really would like to be more present in the workplace. And if we are genuinely going to be as inclusive as we need to be, I think rather than seeing it as if we're doing tokenistic gestures, we need to rethink how we advertise things, how we extend our inclusivity to be, rather than being tokenistic, or, oh, actually we've ticked this box with regard to we've met all the areas, that actually we are. So that's something that I'm trying to do. So at the moment, one of the pieces, and I'm meeting with a Lord Lieutenant, as it goes, just next week, because he's quite good and he's working with lots of businesses, and he was saying to me about, oh well, we're looking to see how charities can help businesses, and I think he was rather expecting me to say, oh brilliant, I want as much money as possible, which of course I do, but I said, actually, but I don't want to have that conversation with business. I want to talk to them about saying, what are you doing in your workplace to make sure, beyond the disabled toilets, to make sure beyond, hearing loops and everything, what are you genuinely doing in your workplace and your recruitment to make sure that you are opening? Because I think that businesses are missing out, and actually putting people on, on particular benefits and actually not enabling them to work, I actually don't think is beneficial for society as a whole. And actually the individuals who want to make their own valued contribution. They want their voices to be heard. That's just one of the things that I'm thinking of at the moment.
Part of being an inclusive practice as well is incorporating wellbeing initiatives, because being motivated at work has a positive mental attitude. In terms of your wellbeing and your pursuit, how do you deal with your wellbeing so that you don't risk burnout? Because you do a lot, Claire.
The way that I deal with it is actually through running. And I always say to people, I don't run for the physicality. I run from a mental health perspective. And that is the one thing that my husband does sort of always say to me. He says, I really, really rue the day if ever you, break a leg, because you would be absolutely awful to live with. There are times when I come back after particularly challenging meetings that before I've got through the door, he just hands a pair of trainers to me and go, you might want to go and run off. So I go and have a run, and I just try to do that. I'm not checking emails. I'm not on my phone. The reason I do that is because basically I'm not a good enough runner to be on my phone and run. I'm concentrating on breathing, concentrating on my next step and not falling over. And I thought, there's either two ways I can cope with this, because I was but I was working 7 days a week, in social care. The charity I was running, we ran 24 hours, 7 days a week. So I was there with them, and I thought I can either have a gin and tonic in between any sessions that I have, or just go for a run. And I thought, as much as one might be more tempting than the other, I'll stick with the running. Until one time I just ran for ages, and actually that led me to a fundraising initiative that I did over COVID, that I ended up running an ultra marathon. So I got to the point of I actually ran 50 miles. So I did a 30 mile, a 40 mile and a 50 mile. And people might think, oh yes, well, that's impressive from a running perspective. But actually that is the thing that got me through running a social care charity during COVID. I haven't run 50 miles since then. I'm running a marathon on Sunday, but that's because I'm doing it for a friend who lost her son to suicide, and it would be his birthday on Sunday. So I'm not doing that. So I hope that the world is never in a position again that leads me to be so stressed that I get to the point of having to run an ultra marathon like COVID. But who knows what the future may bring.
Just to come to the end of the very first recording of our Women in Leadership podcast, what is your one key takeaway message that you want to leave listeners?
I think my one key message is seek to understand rather than be understood. When we come to formats like that, always come to it no matter where you are on the billing, what you're doing, where you're positioning, who you're talking to, the reason for going in for a meeting. Go into that seeking to understand, because the reason I love doing work with IHSCM and being involved particularly with this Women in Leadership is that I have learned so much, because there's actually just listening. You realise that you can learn, and the more you learn, the more you can go in. So I just think, let's genuinely listen a little bit, and just when you're interacting with people, seek to, it's Stephen Covey said it. I didn't come up with it. I've stolen it from Stephen Covey, but I say that in complete, testament to him. So that's the one thing that I would share that I live by. Just try and do that a little bit more. Seek to understand rather than be understood, and we'll all be better as a result of that.
We've come to the end of episode 2. It is clear that despite meticulous planning of our career path, our career trajectory doesn't always align. We may find things that just fall into place, or discover skills that we have are best used elsewhere. Seek out networks, and particularly individuals who will lift you up with them and encourage your growth. Despite adversity, with passion and drive, you can achieve tremendous things. What may seem a small contribution in the early days will reveal itself as a much larger contribution in years to come. We must not forget our well-being along the way either. Taking time to do things that you enjoy on a daily basis can put you in the right mindset for the rest of your day. Whether this is going for a run, whether it is going for a walk, doing a crossword puzzle or something else. Those little things also add up to big things in the overall picture for the well-being that you have during the week. It is not a race, but a steady journey as you discover yourself along the way. The career you start with may not be the career you end up with, and that is part of your your development as a strong woman in leadership. Join us in episode 3. We'll hear from Jill Phillips, creator of Who's Shoes, a transformational tool for health and social care to improve communication with children in healthcare settings and to be more effective in delivery of maternity and dementia care. Jill will demonstrate how finding your passion, being your authentic self, finding your tribe and staying curious can put you on a path with lifelong ambition, helping to build strength and resilience in purpose and mindset. Until next time, stay in the loop.